To dovetail with Ezra, we certainly have some incredible speakers. And Prof Setswe, if I was to discuss your profile, I would be here forever. So I'm going to give you guys really the elevator pitch, because a man of this stature really deserves a much longer one, but I want to give you the opportunity to have as much time to talk with him and to hear what he has to say. I think many of us at the Institute, we know we've lost faculty members, spouses, multiple parents at our Institute, and I know Prof Setswe, you yourself have had massive personal loss from COVID. So today, Prof Setswe is going to speak to us about government and private sector support for the COVID-19 vaccination program. And I could think of no more remarkable individual. He's the Managing Director for the Implementation Research Division at the Aram Institute, and he was previously with the HSRC. He is a doctor, and he is somebody who has got an absolute passion as the Executive Director of HIV, AIDS, STI, TB research programs, where he grew through the ranks at the HSRC and became the Deputy Executive Director position, which he held from 2006 to 2017. He's an extraordinary professor of HIV/AIDS management at the Africa Center for AIDS Management at the University of Stellenbosch. And you can read his multiple affiliations and the various work that he's done. But Prof Setswe, what I want to say to you is that you contribute every single day in the front line to what we at Vinci say is the influencing, the co-creation of truly authentic ecosystems and sustainable societies. And today we absolutely salute you as somebody who is a gift to our country. And besides the fact that you have an unbelievably huge, taxing and incredible portfolio, being part of technical task team, the South African National AIDS Council, various boards, the Medical Research Council that you've served on as non-executive directors, what blows my mind away is that you've supervised or co-supervised 45 master's and doctoral degrees in public health and health sciences into completion. So this absolutely makes me once again say, when we at Vinci speak about the colors of remarkability and the purple cow of standing out in a herd, you are undoubtedly, sir, one of the greatest achievers, because you give back to these students who now go out into the sector and make an absolute difference. It is an absolute honor and pleasure to have Professor Setswe joining us today and speaking to us. Thank you so much, Prof.
Thank you so much, Dr. Malakunin and Prof. H.B. Klopper, for inviting me to speak at this Curiosita colloquium and to share the floor with Ezra Ndwandwe. I want to speak about government and private sector support for the COVID-19 vaccination program in South Africa. But first, I have put up some speaking notes so that I cannot go all over the place, and will give you a bit of a background on the COVID-19 situation, the COVID-19 vaccines and the vaccine strategy, and also clearing some myths about this before I speak about government and private sector support. So far, and I talk about the latest statistics, 16 million COVID-19 tests have been done in South Africa, 8.8 million of them by the private sector and 7.2 million of them by the public sector. And on the 23rd of August, yesterday, the 37,700 tests that were done, 7,000 of them or 20% of them turned out positive. And yesterday alone, there were about 365 hospital admissions. So we are in wave 3 of the pandemic, and you can actually see the fluctuating statistics in the last 2 or 3 weeks. There was a time when the numbers were around 15,000, and yesterday there were 7,600. And so you can actually see that we're struggling to get hold of the pandemic. And there was a time when Gauteng was the epicenter. Now the epicenter is the Western Cape, followed by KwaZulu-Natal and then Gauteng. And so currently there are 163,000 active cases of COVID-19, and cumulatively since the start of the epidemic in March 2020, we've had 2.6 million people getting infected with COVID-19. Over almost 80,000 people have died from COVID-19, and yesterday alone, or in the last 23 hours, 24 hours, there was 163 people who have died. I know these numbers are big, but we need to paint the picture. Now, what about COVID-19 vaccines? The COVID-19 vaccines are necessary now because a vaccine is intended to provide immunity against the disease. In general, vaccines contain weakened or inactive parts of a particular organism that triggers an immune response within the body. This weakened version will cause the disease in the person receiving will not cause the disease in a person receiving the vaccine, but it will prompt their immune system to respond when the disease tries to attack the body. 2 vaccines have been approved for use in South Africa. Other countries like Angola would have 4 vaccines, and Mozambique also has got 4 vaccines. But South Africa, we have a 1-dose Johnson & Johnson vaccine and a 2-dose Pfizer vaccine, which is given several weeks apart. But before a COVID-19 vaccine can be delivered, there are several steps to ensure that they are safe. 1, vaccines must be proven safe and effective in a large clinical trial. In South Africa, there was a Sisonke trial with more than 25,000 participants in the country. A series of independent reviews of the efficacy and safety evidence is required. The evidence must also be reviewed for the purpose of policy recommendations. Now, the World Health Organization will convene an external panel of experts that are called the Strategic Advisory Group of Experts on Immunization. This group would analyze the results from a clinical trial. The panel will then recommend whether or how the vaccines should be used. And that's why you have 1 dose or 2 doses and whether there's a need for a booster dose. So in South Africa, we have the South African Health Product Regulatory Authority deciding whether to approve the vaccines for national use and developing policies for how to use the vaccines in the country based on the WHO recommendations. For example, the AstraZeneca vaccines, the 1 million doses that were bought from India, were never used because research had shown that they were not going to be effective for the strain that was currently prevailing in South Africa at the time. So why do we need COVID-19 vaccines? There's overwhelming scientific evidence that vaccination is the best defense against serious infections, hospitalization, and death. Vaccines do not give you the virus, rather it teaches your immune system to recognize and fight infection. And many of us know that when a child is born, they get the BCG vaccination against tuberculosis. They later on, 6 weeks later, get vaccination for diphtheria, whooping cough, tetanus, and more recently against pneumonia and also measles. And so for many years, we have actually eliminated the existence of diphtheria, whooping cough, and tetanus. We don't see a single case of any of those diseases because of the effectiveness of vaccines. Now, the COVID-19 strategy in South Africa was for the government to procure vaccines. And the strategy is based on immunizing 67% of the population by the end of 2021. Now, at the moment, they say 67% of the population, which is 40 million people. And we'll talk about that. And I have a different view about something called herd immunity or community immunity, and I can talk about that later on because the expectation in the country is that if we vaccinate 67 or 2/3 of the population, then we get herd immunity. But the scientific advice recently says it's not the case. It's every individual that gets vaccinated gets protection for themselves. So we have the electronic vaccine data system, the EVDS registration portal, and we've got a strategy that says the first group of people in phase 1 that were vaccinated were healthcare workers, and there were 1.2 million of those that were due for vaccination in March. Or from the 16th of April, citizens aged 60 years and older were added to go get vaccinated. From the 1st of July, those aged 50 years and older, and from the 1st of August, those that were aged between 35 and 50 years were also added. And from the 20th of August, I think it was last week Friday, persons aged 18 and 35 years were added onto the list. And so there are certain myths and facts, and because of time, I will not spend time to talk about the myths and facts, but I would have wanted to clear them if they appear in any discussion. Now, the current update is that up to yesterday, there were 10.5 million doses of vaccines that were administered by 23 August. Now, these are some people have got the J&J vaccine and they are fully vaccinated, but some only got one dose and others two. Interesting for my family, I got the J&J vaccine in April, but my wife today got her second dose of Pfizer, and my youngest daughter got her first dose of Pfizer because she falls into the group that was approved on the 20th of August. Now, the key part of my talk is about the private and public sector support for the vaccine rollout. South Africa has got a two-tier healthcare system. The public sector is wholly funded by the government and serves the majority, or we can say about 83% of the population. The private sector is partly funded by the state and by patients who are paying through medical aid. Around 17% of South Africans have access to private health care. But because official vaccine statistics are not split by sector, there is no way of accurately comparing the rollout efficiency of the public and private sectors. What we know is that the government is the sole purchaser of the vaccines. It procures, distributes, and oversees the rollout of the vaccines at vaccine centers, at work-based programs and outreach programs. Part of this function includes distribution to the private sector, which started rolling out vaccines shortly after the public sector. So the public sector may have started in March with the health workers, but the private sector only started on the 24th of May, 2021. So today, it means the private sector has been 3 months exactly rolling out vaccines. So there has been a recent uptick in the vaccinations, but one estimate shows that South Africa is averaging just under 46,000 vaccine doses a day. We know the president said he wanted to see 300,000 vaccine doses, and you can see the difference between what the president wants, what the Minister of Health wants, and what is the reality on the ground. If the country continues vaccinating at the rate of 46,000 vaccines per day, it would take over 2 years to reach the target vaccine coverage of 67%, which we wanted to reach by the end of 2021. So the private sector's willingness to quickly pick up the slack and additional costs of the rollout may be driven by profit, but increasing coverage and accelerating the vaccine rollout would benefit the society at large. And I think the private sector also do not want to see people getting hospitalized and people using their medical aid rather. So with regard to expansion of the private vaccination sites, more than 70% or 1,026 sites of the currently available vaccinations of the available vaccination sites are in the public sector. And but the number of private sector sites, which is 324 or 30%, is growing steadily. The three main private sector players are the medical aid scheme, Discovery, and pharmacy chain groups, Clicks and Discam. Members of the public can go to any site, public or private, without having to pay, which is a great thing for everyone. If the private sector can offer vaccinations more efficiently, then serious consideration should be given to expanding private sites at a faster rate. The counter-argument to this is that private sites are not geared towards mass rollouts, unlike the public side. But again, if you look at the Gallagher Estates, the Cape Town Convention Center, you'll realize the private sector has the capacity to mobilize large places and get a large number of people getting vaccinated. And we have bottlenecks at private sides and public health sides, but we know that if there is efficiency, things can work a lot better. Given its supply chain infrastructure and networks, the private sector can take on bigger coordinating role in the distribution of vaccines. And an existing public-private partnership that works well is the centralized chronic medicines dispensing and distribution, also known as the DEB lab. So state patients registered with the program can collect their state-issued medication from their most convenient pickup point, So other interesting solutions have been suggested, like vaccinating without registration on the EVDS system. Another is procurement strategies that reduce the risk of using a dominant vaccine producer. And lastly, I want to share about the community involvement, that an example of a community-oriented innovation can be found in Limpopo, the poorest province in South Africa. They are at the forefront of reaching population immunity. In closing, I want to say in South Africa, it is the poorest and most vulnerable who struggle to access care and therefore have the worst health outcomes. The impact is a 2-year-long vaccine rollout, whether due to supply-side exclusion, demand-side hesitancy and unrest, or poor planning by government, or global vaccine power dynamics. But we think the collaboration between the private and public sector can do a lot in increasing vaccination uptake. I need to stop here, Dr. Program Director.
Thank you, Geoffrey. I think that was a very profound, few profound points that you've raised. And I've just now reflecting back this morning, I read in the paper that the one professor, and I'm not going to name names here, but the one professor told the other professor to rather go back to his notes from medical school and read about, the logic behind the vaccines. And I think that's not the debate we're trying to discuss here this afternoon, but linked to that, you make a very important point, I think, in that saying, how do we argue around this for communities, and what's the effect on communities and South Africa specifically? And, for that I have value. So if you can maybe just give us 1 or 2 pointers, in really assisting the country to move forward by looking at the majority of people and not maybe the isolated 1 or 2 that have a sideline discussion. What will be your position on that?
Sorry, I didn't get the question.
Geoffrey, so if I look at the reference you made to the communities, the importance that we also look after them and really make this accessible to them, what is maybe 1 or 2 immediate steps we can make and do as a country to ensure that, we get to vaccinating the majority of people in the country?
Yeah, I think the example of Limpopo, the poorest province in South Africa, it's a good example where the people in the community go out to reach the people at the payout points. They reach out people in the villages. They also reach out people who are unreachable. So this old argument that there is inequity in South Africa, there is unfairness in South Africa in the distribution of issues, we don't see it in Limpopo. The Eastern Cape, which is the second also poorest province, is doing better than Gauteng and other provinces because they are bringing in the religious sector, the traditional healers, and all other sectors of society. So they are not limiting this thing to the health sector only.
Thank you, Geoffrey. Appreciate. So if I can maybe, and I don't see any questions or comments, and I'm looking at the time before handing back to Dr. Koonen, allow me just a quick reflection and what I've heard, and obviously Lita will do the infographic for us and we'll see more. But what I hear you saying loud and clear to us as audience, and this is what I will take home today, is we need to roll up our sleeves, that we need to get involved, and it's there for the better of the country. And we mustn't think that if we sit in Gauteng, where the majority of people are, and we have all the resources in the capital city, that we are necessarily better. So get off our ivory towers, look at what's happening in the Eastern Cape, look at what's happening in the northern parts of the country, where we actually follow a differentiated approach and we get the community involved to own the process and own vaccination. and say that's the only way to really move us forward. And that against the background that you've touched on earlier on the whole concept of herd immunity, which is it's a different discussion for a different day. So from a business perspective, what I hear you saying for us as leaders is get involved, look at the best practices, don't shy away from having these open discussions, and at the end, don't just worry about being vaccinated yourself, but look at those that don't have access, that are not close by to facilities and that really need that. And whether we vaccinate with AstraZeneca or Johnson & Johnson, at the end, that doesn't make that big difference as long as we really support our country. And reflecting back to your introduction and where you come from, I also then suspect that this position of you are backed up by your involvement in previous research and addressing HIV/AIDS and people with other incurable diseases in rural parts of the country. So Geoffrey, Prof Keitshepile Setswe, really appreciate your insight here. I think we will definitely need to further this discussion and then take it up for another day. And as we embark on the next phase, as we vaccinate the youth, we will definitely think about the pointers you gave here to us today and reflect on them and evaluate the unrolling against what you've shared with us. Thank you very much, Geoffrey.
Thanks, Prof Klopper. I do see there's a lot of comments in the comment section. So Prof Setswe, complimenting your presentation. Tammy, I would like to discuss yours before we sign off. I see that you say this was a very good presentation. I don't agree with the comment on the scenario against Limpopo. Studies should also focus on other provinces as well. Tammy, did you want to expand on that a little bit?
Yes, maybe briefly. I listen to the news almost every day, and you see the same issues arising in other provinces as well. We've got Western Cape as well, as because when you talk about the access to vaccine and the poor population, so we also have other provinces with the same challenges as well. So hence I believe not only Limpopo but other provinces as well, I'm sure we can find something there in terms of similar challenges.
Yeah. In fact, we were praising Limpopo for doing very well on getting more people vaccinated. They are using community structures to reach out to many more people in the community. But you're right, other provinces also have got some strengths and areas of improvement for getting the vaccination to the levels where we want them to be.
So if I understood what you said, Prof Setswe, it was around the fact that Limpopo was actually a good case study to use on how we could advance the vaccines.
Yes, it was a good case study. We're saying positive things, not negative things about Limpopo and
I missed that part. Oh, thank you very much.
But my closing comment is that we should use, from the business perspective, the resources of the country to reach out more people through COVID-19 vaccinations, because the universal healthcare system wants us to use the resources of the country from both the public sector and the private sector. So we should use this as a case study to prepare ourselves for a properly instituted national health insurance for the country. Thank you for this opportunity.
Thank you so much. I think that at Da Vinci, we speak about the galaxy, and we speak about the fact that our Da Vinci students and alumnus and those that contribute to our community are indeed what we term, and we speak about, that they are stars in our galaxy or constellations. You can see my cow of remarkability and all those aspects. And to both you, Ezra, as well as to you, Prof, I think that there's no question in any of our minds that you are indeed absolute stars in the galaxy. And we always say that it doesn't matter where you put your feet at night, whether it's in a dusty street or on the most magnificent carpet or in the beautiful oceans, we all look up at the same night sky. And so I want to say to the two of you, thank you for being absolute shining stars in the Da Vinci galaxy, for contributing to our Milky Way and really co-creating with us. We look forward to many more endeavors with both of you into the future. And Ezra, we wish you the best of luck to soon be Dr. Ndwandwe, sorry, and calling you Dr. Ezra. And so we really appreciate that and your contribution that you make to this country, and to you as well, Prof. Setswe. I don't think we could have better ambassadors in our Da Vinci galaxy. So thank you very much, and I look forward to engaging with you all next month. And have a wonderful week ahead, and please stay safe and please vaccinate and look after yourselves.